We will kind of have giving information, and then we'll open it up for questions after. And I know Rebecca is a wealth of information from an independent standpoint, and she has cards and other things up there that if you have to leave early or you don't have time to get your question answered, you know, take her information and give her a call. So, all right. Most importantly, I had several people ask me to please remind everybody to silence your cell phones, okay? So if you wouldn't mind checking on that, and I need to do the same thing. So, okay, all right. Well, I know we have a lot to get through, and we have somebody who is here who has a wonderful history and knowledge of the information, and so with further ado, I'd like to welcome Rebecca Pogorzelski. Rebecca, yay.
I just go by yes.
Thanks for being here, Rebecca. So Rebecca is a Missouri SHIP counselor, which is the State Health Insurance Assistance Program. So she is here to educate us today and hopefully make some sense out about all of this. So thank you so much for coming, Rebecca. Appreciate it.
Thank you, Stephanie. Pleased to be here. I have been a SHIP counselor since 2019. I love what I do. I love talking to seniors about this. I don't love that it gets more complicated every year. My conversations are longer and longer because of the complications, but I do love being able to help people make good decisions. This is a volunteer gig for me, so I do it 2 or 3 days a week, generally during open enrollment, which is right now, it's more like 4 or 5 days, just because of the volume of work that we have to get through. My background is I'm a pharmacist. I retired from Express Scripts in 2019, where I was responsible for the Medicare and Medicaid business there, which is how I got all this stuff in my head. And when I retired, I thought, I want to use this and be able to give it back. And so that's why I became a SHIP counselor. We do have to undergo training. We have to take a test every year to make sure we know what we're talking about. And we're not allowed to promote any particular plan. I'm not a broker. I don't sell anything. My job is to help you think through what's right for you, because it's a very individualized decision. I usually say it's the decision is impacted by your health, your finances, and your lifestyle. And that's how I frame the conversation I have with each individual person. So I did have some information on the table up here if you wanted to take it. I do have more Medicare U books in my car if we need more of those. And I do have business cards here so you can call me directly. There is a general number in Columbia that is a call center number. If you call that, you'll get a counselor in your area. I have the St. Charles area along with a couple of other counselors. So you don't have to work with me, you can work with another counselor, but if you take my card, my direct number is on there, and you can leave me a number, or leave me a message, I'll get back in touch with you, and we will have a conversation.
That is awesome, awesome. And you have a wonderful educational history and experience with working with these programs, so that's great, but I guess you have to relearn every year, huh?
I do, and there were quite a few changes that got put into place with the Inflation Reduction Act. That's what really started all of the changes. And let's say the intent was in the right place, but the impacts have been unanticipated in many ways.
Really? Okay, well I guess we're going to talk about all of that. I know these are the books that you were talking about?
Yes.
Okay. So she has extras if anybody needs one. I know I got this in the mail, and it's so much. I don't know how you all do it.
Well, it's really not meant to be read from cover to cover unless you have insomnia. Then it might be a great cure for that. If you go online to get them, you won't get a Missouri-specific version. So I think when they mail them to you, you may get a Missouri-specific. The ones I have on the table are Missouri-specific, meaning the Missouri plans are in the back of it. And there's a limited amount of information on those plans. It's not everything you need to make a decision. And that's where a counselor can kind of help you sort through how do you pick from these plans. We have more plans available in the market than ever, particularly in the dual special needs area. So those are for people who are low income, people who have Medicaid and Medicare, or have extra help and Medicare. The choices there are increasing.
Okay, all right. So where do we start?
Well, I want to know a little bit about the group here. So
Sure.
I'm not going to make an assumption, but how many people are on Medicare today? Okay. Anybody new to Medicare, getting ready to? A couple. Okay. All right. So the majority are on Medicare. Some of this may be a review, but I'll say that in my conversations with people, they still get very confused about A and B and D and C. And then if you're in the supplement market, F and G and M and N, all conveniently letter named. So we can review that. There are no stupid questions. There are no dumb questions. So please ask so that we can make sure to get your question answered.
All right, so you're probably going to need to skip ahead through a few slides because I failed to. Oh, it has to turn on. Sorry. There we go. Green light.
The green light is key. All right. Okay, we did that.
Yay! There's Rebecca.
Oh, you found a great picture of me.
Sorry, we
That's
weren't
okay.
in the middle of it.
I actually like that picture. You know,
Okay.
most times you go like, where they get that picture? Okay, so just to reiterate, the State Health Insurance Assistance Program, it's a nationwide network of counselors throughout the country. All we do is counsel. We do not sell. Most of us are volunteers. There is some federal funding. Our home office is in Columbia, so they have some paid staff, but most of us are volunteer counselors. And we're just here to help seniors make the right decision for them. Some of the things we help with are people aging into Medicare when they first get started, either when they turn 65 or if they're on disability, after 24 months they become eligible for Medicare. We help during annual open enrollment, which is what's going on right now. We help throughout the year if people have issues with claims or billing, so they don't understand their Medicare summary notice, or their EOB says something weird, or they can't get something filled, or whatever reason, they can call us and we can try to help them through an issue. I'm working today with somebody who's trying to appeal something that wasn't paid, so we help with those kinds of things as well. We will screen people for Medicaid eligibility. And there's full Medicaid, and there's what they call partial Medicaid or the Medicare savings programs. Medicare savings programs are also for low-income, low-resource individuals that aren't at the Medicaid, full Medicaid level. That's why it's called partial Medicaid. And it will help pay your Part B, as in boy, premium. So we help screen for that. We help screen for the Extra Help Program, which is a program offered by Social Security to help cover the costs or lower the costs of medications under Part D, as in drug.
So it sounds like, I mean, you're a great resource to just say, have somebody say, can you tell me all of my different options, because they might be missing some. I didn't know about this partial Medicaid
Yes.
option you just mentioned. I don't know. Were you guys aware of that, anybody? No? Okay, all right.
So sometimes Social Security does some mailings. They look at IRS filings and try to determine if you're low income, low resource, because they believe that not everybody who's eligible for this program is taking advantage of it. So they send letters that say you may be eligible for this, that, or the other program. Call SHIP, and that's who you're calling. You're calling, and They exist in all states, so if you have friends in other states, there are SHIP counselors there as well. And we can do the screening. We can also send you the applications or help you with the applications if you qualify.
Can I ask another group question? Has anybody ever worked with anybody from SHIP, taken advantage of their, this free service? One person. Okay.
How was your experience?
Very good, I talked to you.
You talked to me.
I already called you.
Oh, good to see you again.
So we had Wilma into our seminar before, and she's wonderful as well. So very impressive group of professionals who dedicate their time to learning this and helping advise.
Wilma is my boss. I am not nearly as funny as Wilma, so I'll apologize up front.
She is pretty funny.
She is pretty funny. Okay, so we already know it's complex. It gets more complex every year. So one of the things they added this year, let me step back and say, Medicare offers a fantastic tool online at medicare.gov. It's called Plan Finder, and it helps you evaluate your choices and your different plans out there. It has been around since 2006, when Part D officially launched. It's just gotten better every year. I really do trust that tool. This year, they added in a provider functionality. So you can put your doctors in, and up to 5, and see if they're in the plan. Now, this is brand new. Is it accurate? I don't know yet. I don't know if any of the online provider directories are accurate, and I tell all my clients that. We can look directly at X company's website and see, is Dr. Smith in there? I don't know that I always trust it. I always encourage people to confirm with the doctor's office, are they participating in this particular plan? So the fact that they add this in is terrific, but it adds a whole nother level of complexity, because now we're looking at the plan name, we're looking at the premium, we're looking at the deductible, we're looking at the maximum out of pocket, we're looking at the extra benefits, and now we're looking at the doctors in the network. So you have even more to think about. Choice is good, but it comes with complexity. Move on?
Sure.
Okay.
Go ahead.
All right, so what we don't know yet, we do not know the Part A and Part B. Part A doesn't typically have a premium because you've paid in through your FICA taxes. The Part B premium, which is $185 this year, we do not know yet what it's going to be for 2026. None of us have any control over it. It's going to be what it is when it comes out.
So we were talking about this this morning. I'm like, I don't understand how it's open enrollment and people have some information but not all of the information. How can you be deciding anything? So Rebecca had great information to answer that. So
yeah, this doesn't really impact your plan choice, the premium or the deductible, because you're subject to it regardless of what choice you make. The information about the plans that are on the market is all available. What's not available is what Medicare itself controls, which is premium and deductible for A and B. We do know premium and deductible for Part D, the drug benefit, that's out there.
because that's a separate plan.
It's separate, offered by private
Yeah.
independent companies.
So the private independent companies have their act together. It's the government?
The government?
Is that it?
Yeah, I don't know what approval process it actually has to go through, and it could be held up by the shutdown. I'm not sure.
Okay, that was going to be my next question.
Yeah.
Okay.
What I do caution everybody is to review the annual notice of change that you got in the mail, either email or snail mail. It's a terrible document to read. It's hard. It's like, oh my gosh, it's that time of year again. But some of them do a nice job at saying, here's what you have right now, and here's how it's going to change next year. And so you can just look at the differences. sort of in a table format. There's a bunch of text too that you might want to read, but at least the table will give you an idea of what the big changes are going to be from last year to this year.
So who sends that out?
The plan sends that out,
The individual, okay,
and it should come in September.
okay.
Yeah.
I remember getting that. And
You did
it's-
get one?
Yeah, well, I'm not on it yet, it's for my parents.
Okay.
But I get all their mail to handle that, so, yeah, it was not even pleasant to look at.
No, it's not.
So-
And, companies have liberty to format it any way they want, so some of them do a good job and make it easy to understand, and others you're like, oh my gosh, this looks like another government
But
document,
that's just giving you a comparison on your current plan.
to how it's going to change for the following year.
Yeah.
And if you do nothing, chances are you're just going to stay in whatever you're in. What's really important to know, though, is that some plans are leaving the market this year. And that's what you don't want to miss. So, for example, Anthem Blue Cross Blue Shield is no longer offering a standalone prescription drug plan at anywhere. They just got out of the market completely. And they send you a notice, but do you read it and understand what it says? And where I found some people are confused is that they have Anthem Blue Cross Blue Shield supplement, and they have an Anthem Blue Cross Blue Shield prescription drug plan, and they don't necessarily understand the difference. The supplement is not going away. The prescription drug plan is. And if you don't do something about it, you will be left without prescription drug coverage and then subject to late enrollment penalties. So that's why it's important to read that closely.
So anybody that has Anthem, beware and dig into the details.
Yes.
I think you want to stay with them.
The Anthem prescription drug plan. Well, we can help you look for a different prescription drug plan. There are 10 available in our market.
They
That's,
actually didn't send out a letter. They
Is there-
actually did not send out a letter. I got the letter that I was being canceled. When I called, they said that was 300,000 something people got that letter by mistake.
I heard that a letter by mistake went out. I had talked to somebody yesterday about that, and they got the letter that said it was being canceled, then they got a letter that said it was a mistake, and so we're not quite sure. I still think she was in the prescription drug plan, and she had a supplement plan through Anthem. So that is continuing, but we got her in a different prescription drug plan.
Confusing. Okay.
She's still with me in the Blue Cross Blue Shield.
Oh, you are pretty close. I will scoot my way.
Are you nervous? I didn't want to be in the way of you. There. Okay.
You don't
thank
care if
you.
I fall off.
Okay, so what's changing on Part D? This is the drug benefit. There are going to be 10 plans in our market this year. We used to have a plan that had no premium, the WellCare Value Script plan. That was fantastic for seniors that didn't take any medications or that were just on a few generics. That plan now is going to cost $9.60 a month. It is still the lowest plan out there. 2 of these 10, their premium is over $100 a month. So, and the premium does not count towards your maximum out of pocket. So last year they put in a $2,000 maximum out of pocket for covered Part D drugs. That's important. Covered, meaning on the formulary. Next year it's going to be $2,100, but premium does not count to that. So you really don't want to take a plan with a really high premium unless that's the only option for your drugs being covered. And that's where we can kind of help you decide. A lot of people will just stay in the plan that they're in because this is just too much. It's too much to process, but we can make it easier for you. Was there a question back there? Did you have a question? Okay.
Just waving to me, I'm late.
The deductible for Part D is going to be $615. Not every plan has this. We do have one plan in our area that has no deductible to it, and then we have one or two that are, I think one's in the 300s and one's in the 400s. The rest have 615.
Is that's an increase then?
That is an increase from like 580, I want to say. Yeah. And in this market, the deductible applies to all tiers in the standalone Part D market. It used to just apply to tier 3s through 5, but most of the plans are now applying the deductible to all tiers. The extra help guidelines are still to be determined, so that's the program I said was offered by Social Security for low-income individuals, and low income for a single individual is $1,976 a month. It's higher for couples. I don't remember the resource number, but I could look it up if you're interested. I did mention the maximum out-of-pocket goes up to $2,100, and if you happen to be in the Medicare prescription payment plan, which is sort of like budget billing for your meds, it will auto-renew if you stay with that plan. If you change plans, you might have to reset that up. That was also something new last year. Most people didn't know about it, or they didn't understand it, or they didn't trust it, because very few people enrolled in it. Less than 10% of the people enrolled in it.
I think people don't understand what it was, because that sounds like maybe a good way of budgeting.
I would think so too. There are, depending on your drug mix, some seniors hit that $2,000 in January and February. And so the idea was to help them spread that out, so they weren't hit with big bills in the beginning of the year, and then left with nothing at the end of the year. But very few took that up. Now we'll see this year if more people get involved in that. On the Part C, which is Medicare Advantage, so you think of Part C as A, B, and D, all rolled into one benefit offered by private companies. The Uniteds, the Humanas, the Aetnas, the WellCares, yes.
On your previous slide, you said Cigna, on the right, it says Cigna plans are now known as?
Health Spring. Oh, it fell off. Health Spring, sorry.
Health Spring?
Health Spring. Yes, thanks for pointing that out. I did mention that Anthem Blue Cross Blue Shield left the prescription drug market, but so Cigna sold their Medicare business to HCSC, which is a Blue Cross Blue Shield group out of Chicago. And their product is named Health Spring. And so that's the new product in our market. It is a Blue Cross Blue Shield product. If anybody's in Cigna for their prescription drug plan, they'll likely roll over to something called Health Spring next year.
And just out of curiosity, so how many, is, I would think, the Anthem, that's a name I know anyway.
Yeah.
So is that a pretty popular plan that a lot of people are having to find anew?
That's a great question. I don't know their enrollment. I could probably look it up, and
So let's ask the group here. Anybody that has been enrolled in the Anthem prescription Part D? Is that the
couple people. Okay. Okay, yeah, just curious. So Part C, Medicare Advantage, these are popular. I would say a little more than half of the people are in Medicare Advantage, a little less than half are in original Medicare with Part D and hopefully a supplement. They are popular because they have extra benefits, the hearing, the vision, the dental, the fitness, the pharmacy card. More plans this year are offering some money back on your Part B. Previously, we had maybe, I would say 3 years ago, we had none. 2 years ago, we had 1 or 2, and they were only offered for the dual plans, people that had Medicare and Medicaid. This year, some of the plans that are open to everybody are giving some money back. Now, it might be $1 or $2. I'm like, $2? Really? I don't know that that's going to change somebody's decision.
So
overall.
how do they get money back?
That's a great question. I don't know the answer to that either, because this is sort of new in our market
Okay.
as well.
Is it those that you get X number of dollars, like on a U card or something? Is
No.
that- No, okay.
I'm thinking somehow, instead of taking 185 out of your social security, they're taking 183.
Okay. We're such a deal.
Now, some of them are higher. I don't know that anybody's giving all of it back. So it's just something to watch. I don't know that it's going to be a lever that just decides one plan over the other. To me, it might be a cherry on top kind of thing.
Gotcha, okay.
So you can see the number of plans increased from 139 to 157. Who in their right mind wants to sort through that kind of stuff, right?
So, and that's what is available in our area?
Yes. Well, no, in Missouri. This is a Missouri number. In our area, I would say there's probably about, it does vary by county. So we serve 6 counties, or I serve 6 counties: St. Louis, St. Charles, Lincoln, Jefferson, Warren maybe, and St. Louis City and County. So it varies between 21 and 25 Medicare Advantage plans and close to 30 dual Medicare Advantage plans. So those are for people who have Medicare and Medicaid, or Medicare and partial Medicaid. So that's 50, right? Yeah, close to 50 plans. We don't look at all of that. So here's where I can help you is to say, we choose plans based on, is my doctor in the network? What do my drugs cost? What's the maximum out of pocket? Those are the top 3 criteria. And then we narrow it down to maybe 3 plans. And from there, then you start evaluating the extra stuff, like whatever's important to you. If dental's important to you, that might make one plan rise to the top. If the pharmacy card is important, that might make one plan rise to the top. If fitness is important, that might make one plan rise to the top. And I will tell you, some of them have dropped their fitness benefit. Why? I don't know. To me, that is just a no-brainer to keep. But I believe Anthem Blue Cross is one that dropped their fitness benefit, which surprised me.
They don't want you to be healthy. They want just, more drugs.
Well, they also found that a lot of these benefits were not being used.
Silver sneakers.
So I think they went through their population and looked to see who's using these things and either kept them or got rid of them based off that.
Okay. Silver sneakers has been dropped?
Yes.
By everyone?
By Anthem.
By Anthem.
At least.
Okay.
I don't know about other companies.
Thank you, ma'am. Thank you, ma'am.
So in red here, I'm pointing out that some plans are not renewing for next year, so make sure you look. Some plans will map you to a different plan, so I think Aetna, for example, changed the name on all of their plans. I don't think the plans changed, like the number of the plan ID number didn't change, but the name of the plan changed. So they may tell you, last year it was Aetna SmartFit, this year it's Aetna whatever. And I'm just using that as an example. Other plans have also changed their name. United pretty much kept theirs the same, which is helpful when you're moving from year to year. This is the slide that's actually in your handout. And it's just a review of Medicare, the parts, and your 2 choices, basically. By default, everybody gets enrolled into Original Medicare. That's what you get when you get your red, white, and blue card. That's the one on the left-hand side. It's Part A and Part B. Everybody has that. But you have a big choice to make once you first enroll, and that is whether you stay in Original Medicare or you move over to Medicare Advantage. And there's pros and cons of each. And it's a very individualized decision, which is why you need to talk to somebody you trust about it.
And there's limitations on that. You can't keep flip-flopping back and forth, right?
Great point. You're right. So when you're in original Medicare, it's an 80-20 plan, so Medicare covers 80%, you're responsible for 20% with no cap. So you have an incident on Highway 70 here, you wind up in the hospital, you got a broken pelvis, you got a broken shoulder, you rack up a $500,000 bill, 20% of that's yours. So what people will do to protect themselves, one of two things. They either get a supplement plan, which you pay for in advance, or they join Medicare Advantage. When you turn 65 and activate your Part B, you get a 6-month window to buy the supplement coverage under what they call guarantee issue, meaning no medical questions asked. You don't have to disclose if you have high blood pressure, cholesterol, history of cancer, none of that. When that window closes, you can still get one, but you might have to undergo medical underwriting. And that's when you have to disclose your health history. And at that point, they can either increase the premium or say, oops, you're a little too risky. No, thank you.
So that, I mean, that's really, really important to know for people who are just getting ready to look at enrolling in the plan.
Yes.
That you can't continuously flip-flop back and forth.
You can always go this way, you can always go left to right. You cannot easily go right to left. So for those people just thinking about Medicare, that's a big decision. If you're still working and you're over 65 and you retire, you get another guarantee issue window. It's shorter, it's 2 months. So you don't lose it if you're still working with qualified group health coverage.
Okay, thank you.
Yeah, so you also add Part D. They will tell you Part D is a voluntary benefit, but if you don't get it and you don't have coverage.
It's a lot of exposure there with 20%, right?
And a late enrollment penalty on Part D if you don't get it.
Okay.
So I was talking to a lady yesterday who became eligible for Medicare in 2003 and did not ever get Part D. Now she became eligible due to a disability, so she was under the age of 65. She's still not 65, but has not had Part D. She would have a 20-year plus late enrollment penalty. So she's not going to do Part D. Luckily, she turns 65 in a couple of years, and she'll be able to get Part D then. But right now, she's in the cash paying market for her medicines. Now, she has been for the last 20 years, and I guess it hasn't been a big deal. But when we talked this week, I was like,
So do you remember like what kind of penalty that was?
it's 1% a year, 1% for every month you went without coverage. So she had 20 years times 12 months, right? Is 120% of the benchmark premium, which this year is $38. So she would be paying an additional $60 a month in penalties. Yeah, it's not,
Okay.
would not be good. But she's like, nobody ever told me. And that's why it's important to get educated, get informed, and share what you know with other seniors so they don't get stuck without Part D.
Absolutely.
So on the right-hand side is Medicare Advantage. We talked about it being managed care. What people like about this are the extra benefits. What people don't like are the restrictions. So normally you have to use a doctor in the network. You have to get things pre-approved, prior authorized. You have to appeal them if they're denied. So there are rules there. Now they do have PPO versions of Medicare Advantage, which allow you to go outside the network. But the risk there is that they have much higher maximum out-of-pockets, like $6,000, $10,000 maximum out-of-pockets. So you just have to be aware that that's additional financial exposure for you if something were to happen.
And I know I've heard a lot of people mentioning this, specifically someone mentioned it that's here today about their doctor no longer being in certain plans. And can you speak to that a little bit more on, what does that look like on a whole? Is that happening to are a lot of doctors and groups not participating in the plans?
We are hearing that some are pulling back from Medicare, particularly dentists, which is why a lot of people go this direction, is because they like the dental benefit here. But a lot of dentists are saying, I'm just not going to do Medicare. So you're back into a cash paying situation or changing dentists. You do have more doctors becoming part of practices now. And so they're not necessarily making the decision to participate or not, their practices. And they can leave in the middle of the year, and there's nothing you can do about it. You can't change plans. You have to change doctors. Yeah, that could be tough. Yesterday, I was talking to somebody who had 7 different doctors. Imagine trying to find a plan that had 7 different doctors in it. We didn't. She's going to have to probably change one or more of her doctors. Yeah.
That's fun.
The cost for a specialist went up too, for everybody.
The cost for specialists?
Yeah.
Yes. Most of these plans have a $0 copay for your primary, but the specialists went up to like $45. And in some cases, it's a percentage. So be careful, especially in the PPOs. They'll say like $45 in network, 40% out of network. So, and that's not predictable. That's like 40% of what? Right?
Yeah.
You don't know what that is. So that's hard. They have, I mentioned the Part B give back on some plans. Some plans are offering transportation. May not be important to you. You all found your way here. But for a lot of people, that can be an issue. They don't have a car or can't drive for one reason or another. Most of them are offering home-based meals after hospitalization, which I think is nice. Make sure people get fed.
3 days.
It's usually limited number of meals. Yes?
I was just wondering, you mentioned in-network and out-of-network several times. If we're on the original Medicare, and I see out-of-network, what is the ramification of out-of-network when it comes to the original Medicare?
Great question, and I missed that, so thank you for asking that question. The benefit of original Medicare is there is no network. You can go to any doctor anywhere in the US that takes Medicare. So while you prepay for this supplement and original Medicare, there's no network, you can go anywhere, there's no pre-approval or prior authorization yet. They are testing it in 5 states, but Missouri's not one of them, thank goodness. So it's sort of hassle-free Medicare, but you have to pay for it up front. These plans often have no premium, no deductible, you pay co-pays up to the maximum out of pocket. And you deal with the network issues, you deal with the pre-approvals or prior authorization issues. So there's pros and cons of each. I tell people, think about, how much do you travel? Do you winter somewhere, summer somewhere, and you have to worry about, is my doctor in the network? I did notice this year that United and Aetna are making their national networks available in a couple of their Medicare Advantage plans, which is nice for people that are already on that side of Medicare.
So with Anthem, I've seen in the records out-of-network. That means nothing?
Shouldn't mean anything if you're in original Medicare, because there's no network.
Okay, thank you.
Yeah. Last year, you may remember that Anthem and Mercy were having their little kerfuffle about, Mercy doctors gonna take Anthem, right? We were all nervous. And a year ago, anybody who was using Mercy, I couldn't say, you need to think about Anthem. In fact, I needed to say, you need to have a backup plan if you're in Anthem, and they don't come to the table and agree. They came to the table and agreed, but it caused a lot of consternation for people that were using Mercy providers in our area here. And that is something that will continue year over year. Yeah.
I lost 2 doctors in a row that left Medicare Advantage and my concierge.
Yeah, we are seeing that too. Doctors leaving Medicare and going concierge. And some people actually have a concierge doctor in addition to Medicare. So a concierge doctor is mostly cash paying doctor, so they don't take health insurance at all. Usually pay a monthly fee, and then you can contact that doctor pretty much whenever you want. You pay for labs, you pay for x-rays, you pay for everything on a cash basis.
And if you want further information, see Miss Sharon over there about the concierge doctor. She has a lot of medical dealing with experience in dealing with doctors and situations. So I'm just saying, you've been really great knowledge source for me, so thank you.
Yes.
I keep hearing Anthem and these. We are in the Essence program. Do you know anything about that?
Essence. Essence was our first and only 5-star plan in our area. And they held that 5 stars for 3 years. Some of their plans are now 4, some of them are now 4.5. Honestly, I would not be worried about that. I think Medicare came in after 3 years and said, we gotta find something for you to improve on, and dinged them on something, and they became 4 and 4.5 stars. I don't think that signifies a change in their overall quality. And I'll tell you, for every single one of these plans, Aetna, Humana, United, Essence, WellCare, Anthem Blue Cross Blue Shield, I hear good and bad about all of them. Yes?
Can you switch between Medicare company providers?
Another great question. Can you switch between Medigap providers? Yes. In Missouri, we have what's called the Missouri Anniversary Rule. So if you have a Medigap plan, it has a policy date. Just like your home insurance has a policy date that it starts. The 30 days before, the 30 days after, you can shop your plan, and if you find a cheaper one, you can change without medical underwriting. You need to stay with the same letter name. So if you have a G, you need to stay with the G. But you can go from company A to company B in that 30 days before, 30 days after, without medical underwriting.
Last year, I was told that Anthem was exempt from, if you had Anthem, you could still go to Mercy if you had their Medigap policy.
That's correct. And the reason why, the question was that Anthem, Mercy, kerfuffle didn't impact people who had a Medigap plan, and that is true. And the reason is because when you're in the Medigap side over here, there's no network. So you don't have to worry about these doctors and fighting with health systems. You go to anybody you want that takes Medicare, in or out of network. It doesn't matter because there's no network.
So, yeah, so Medigap is one of the supplemental coverages under that you get with original Medicare.
You buy it from a private company.
Right.
Yeah, it's like buying an umbrella policy or a little rider on your home insurance.
Okay.
Yes, it covers that 20%.
Yes.
It gives you peace of mind because everything's covered. You do have to pay for it in advance, but you can budget for that because that is a fixed recurring expense every month.
Yeah. You don't have to have it, but it only makes sense to get it, most likely.
Yes.
If you don't want to have that exposure of 20% of whatever.
That's right. If you have a healthy year, there's not much exposure, but all of a sudden you get a diagnosis of something where you have an accident and now you're exposed without limit, and that can be frightening. Yes?
Do any of the plans for next year cover dental implants?
Another great question. I would have to do more research on that. So a lot of them specifically excluded dental implants last year, and that's where you sort of have to dive into the summary of benefits for each of the plans that are out there. So how would you do that? Because there's 20 some odd plans. I would pick the ones with the highest dental benefit out there and then read the summary of benefit to see if they specifically exclude implants. Yeah, a tedious process at that, yes. Good question.
Ask your dentist, maybe your dentist might know. What about the benefits of over-the-counter and groceries?
Most of the grocery benefits were on the dual plans, and the pharmacy benefits are now, sometimes they're as low as like $40 a quarter. So they have really, those have decreased this year.
Okay.
Anthem had the groceries and the over-the-counter. I got both.
They may have. Anthem was one of the ones that was more generous on their card last year. They also have a transportation benefit. So it's interesting to sort of watch the markets that they're going after. So they offer groceries and transportation, but they drop fitness. So clearly they're targeting a certain market.
Right.
Yes.
Okay.
Part A, I think we covered Part A as generally having no premium. It covers mostly everything associated with an inpatient hospital stay. Inpatient hospital stay is defined as a certain number of nights, overnights, an admission and overnight stays in a hospital. There are some things to watch for. You think you might be inpatient and it gets reclassified to outpatient because maybe it was only one night observed. You're supposed to get notices about that. I think I have a slide that has what that specific notice is. I think it's a moon notice that you're supposed to get. If you are fully covered, it's going to be covered for you, but there could be different costs if you're in Medicare Advantage, whether it's hospital or outpatient.
And I just wanted to point out one thing, the skilled nursing facility care.
Yes.
That is only for an interim
It is.
event, right? Like a rehab.
It's rehab, up to 100 days of coverage, and it must follow an inpatient hospitalization. Yes. They don't cover anything after the 100 days. They don't generally cover long-term care. They cover your medical costs for somebody who needs long-term care, but they don't cover room and board or any of that. And that's where like long-term planning with an elder care attorney comes into play if that looks like it's going that way.
Right, right. So that's, I know people have gotten confused on that, thinking that covered skilled care from your Part A, just covered long-term skilled care, and it absolutely does not. You need something, either a more robust plan that you've been working on ahead of time, or a long-term care policy for that.
Yeah, the other one that people get confused about is hospice, which you could do either in a facility or at home. And it covers the hospice care, but not room and board. So if you are in a facility under hospice, some of the care is covered, but the room and board is not covered. So some people didn't understand that either.
Okay, thank you. And note here that the 2025 deductible was $1,676. You've got for 1 to 60 days?
Yes, the first
What does
60
that mean?
days. Oh, gosh. This is crazy confusing. They actually run the hospitalization benefits on what they call episodes of care. So let's just say you're in original Medicare without a supplement, you would pay the $1,600. Let's say you went into the hospital in February, you pay the $1,600. You come out in February and you go back in March, you don't have another deductible. But if you go back in June, which is more than 60 days later, you will owe another deductible.
Oh.
Yes. So you owe a deductible for every episode. And that might be the wrong word, but they look at 60-day increments. If you go 60 days without being in the hospital and then go back in, it's a new episode, new deductible. That's why you want a supplement plan if you're in original Medicare.
So if you have a supplement, Part A doesn't have any participation?
If you have a supplement, then your supplement covers this cost. That's why you bought it and paid for it. It covers your deductibles. It covers your deductibles and it covers your copay or your 20% is what it covers.
Yeah, okay. And this is where I was like, what, 2026 to be announced? I'm like, what, come on, we're in open enrollment, aren't this supposed to, information be out there, but.
Yeah, it's only relevant for people who are in original Medicare without a supplement because they're exposed to this. If you have a supplement, your supplement's gonna pick it up, so it doesn't really matter. And if you're in Medicare Advantage, this does not apply.
Yeah, okay. Perfect, thank you for explaining that.
So Part B, think of that as anything that's not in the hospital. So all your outpatient medical, physician services, labs, diagnostics, durable medical equipment, pretty much everything else. It does include medications that are administered in a physician's office. So that can get confusing. So I had a discussion yesterday about Prolia.
Oh, yeah, I got that one going right now.
Yeah, which is generally administered in a physician's office, should be billed under B, as in boy. But if you look up Part D plans on Medicare, you'll see Prolia there. So it's like, why would anybody bill Part D when they could bill Part B? But that's an example. Chemo drugs, MS drugs that are generally infused are covered under Part B, as in boy. Transplant drugs, so there's some weird oral drugs that are used for transplants, covered under Part B, as in boy. It's a mess, and it creates a great job opportunity for auditors to come in and make sure that everybody did it right.
So I mean, if you want, the best way to do it would be under B, is
Yes.
what you as the individual wants it to be classified at.
If you're in original Medicare with a supplement, because then it's covered. If you're in Medicare Advantage, you might want it be under D, because Medicare Advantage plans often charge you 20% from infused medications.
Okay. All right. And then I had a question about that. I'm trying to remember what it was though. Oh, the administered so that's if you have it administered at the doctor's office. So
Yes.
if they give you it to self-administer, that would be different.
That's D.
Okay.
D. So now we have lots of self-administered drugs. Some insulins are self-administered through a quick pen. Some cholesterol meds are self-administered through a quick pen. Those are D. Insulin in a pump, however, is B. I know.
The details, okay.
So the last line on here was the outpatient hospital stay. It's covered under B. This was what I was referencing to before, the MOON notice, which is the Medicare Outpatient Observation Notice. You're supposed to be given one of those if it's possible that your hospitalization stay is going to be considered outpatient. Okay, so now we're going to cover Part D and supplemental coverage. So Medicare Part D, the drug benefit, that started in 2006. It has evolved significantly since then. Some of you may remember the infamous donut hole. It's
Yes.
now gone,
Yeah.
for good or bad.
Oh, I don't like the donut hole.
And in last year, in 2025, they put in a maximum out-of-pocket of $2,000. That will be $2,100 in 2026. It impacts maybe 10 to 15% of people hit catastrophic. Although we're getting more and more drugs on the market that are so expensive, I think more people will be hitting that $2,000 amount. Yeah. We've already discussed, they're sold by private companies. There's 10 of them in our market available. Anybody who's on Silver Script used to be our least expensive plan for many, many, many years. Last year, they consolidated their 3 plans into one. A lot of people didn't notice that until they got their $44 a month bill. And then they were like, oh no, what happened? And then they realized they were stuck. They still only have one plan, but I think the premium went up to like $70 or something a month now. 94
per month.
Yeah, so that is the signal that it's time to look around. Time to look around.
So that's why this open enrollment comes around every year.
Yes.
There's so many changes. And
Yes.
we as individuals have made a lot of changes where maybe you were, very, didn't have a lot of medical expenses, and then you have an incident, and all of a sudden, you have a lot.
That's right.
Yeah.
That's right. Now, I think it's critical you find somebody you trust to work with. If that's a SHIP counselor, fantastic. If it's a broker, that's great too. But I will tell you that a lot of these plans have stopped paying commissions to brokers. So just be aware, they may not offer everything to you. It's upon you to make sure that you ask about everything that might be available. The low-cost plans that might be great for you may not be paying a commission. So there's really no incentive for a broker to sell it. I'm not saying they would do that necessarily, but I have had people tell me, well, no one told me about the WellCare Value Script plan. Well, that's because they don't pay commissions. So. And they actually are only appointed to sell certain plans too. Particularly on the supplements there, they have to be appointed to sell those supplements. On Medicare Advantage and Part D, anybody can do that. You can self-enroll yourself, and it's super easy. It really is easy. So anybody can do it. But yeah, they may not be showing you everything if there's no commission in it for them.
And that would be one particular company more so than anything else. I thought that was kind of interesting.
Well, I would say, I think it's a good idea, again, to consult with a SHIP counselor, and, then you guys don't sell anything, right?
We do not. No.
So, then you can go talk to a broker too and get further information.
You could do that too. Yep. I always believe more than one source of information
Yeah.
is good, especially in the medical field. Even when you get second opinions, right? Because more information helps you make a better decision, I think. Yes.
Where do you find these brokers?
So there's quite a few of them out there.
There's lots of them out there.
I know we've had one, I've had one in before, that I subscribe to their newsletter and get information, that, I feel good about. So I'd be happy to share that information, and I'm sure there's other people here that maybe currently go through a broker. I know one of them just recently retired though, that quite a few people used and loved. But yeah, and SHIP doesn't normally allow, or at least the big boss doesn't allow to have a broker come in when they're here giving information. So otherwise we would have had somebody here, but yeah, I get that and respect that, so.
Yes.
Okay, I came late, so I'm not familiar with the SHIP. And is there a fee for a SHIP counselor?
No, there's no fee for what we do. It's a state health insurance assistance program. It's a national program of volunteers that help counsel on Medicare. So I am a volunteer. I do it 2 afternoons a week. All I do is provide information and help you make the decision that's right for you.
Do you need to make an appointment then?
Generally, it's by appointment. I have some information up here. There's a call center number. I also have my card here. You can call me directly. If you call the call center, you'll get a counselor in your area. There's 3 or 4 of us that do St. Charles area. And we'll either have a conversation over the phone, or we can do face-to-face in the study rooms here in the library.
Thank you.
Okay, yes.
Is costs keep going up? A lot of people like to point at each other. They're to blame. Since you work for a PBM, are they good guys or are they bad guys? And the second question is, I have a feeling that a lot of nonprofit hospitals are really not acting like nonprofit hospitals. They've gotten pretty entrepreneurial and pretty digging for money. Can you address that, just trying to control things and having all this yelling and screaming back and forth? Especially question about shifts. Or it's not shifts, PBMs.
Oh my. Oh my.
So I guess start by, what is a PBM?
PBM is a pharmacy benefit manager.
Okay.
And I probably mentioned I retired from Express Scripts. I managed Medicare and Medicaid there, so I didn't do so much of the pharmacy benefit managing work. I think initially when they started, the idea was fantastic because they were trying to help mostly employers whose business is what they do, not health benefits, right? So they were the expert to help understand how to promote the use of generics, which was cheaper. Over time, things have changed. And I will say from wholesalers to PBMs to all of the other players in the healthcare market, the pharmacies, the hospitals, the clinics, the health plans have all wanted a piece of the healthcare dollar. And because it's set up in a free enterprise way, meaning we don't have socialized medicine, you have the market dynamics influencing what's going on in healthcare. Is that good? I don't know. Is it bad? I don't know. Would we all be better off just paying cash for our healthcare? I don't know. It's extremely complicated. It's more complicated than it needs to be. The average consumer doesn't even know what's going on. And the average consumer has no visibility into the true cost of what an X-ray is, for example. Hospitals are supposed to, and plans are supposed to publish that. There was a law that said you have to publish the price of all of your procedures, but you need to know the procedure code in order to find it. You can't just go in there and say, what's the cost of an X-ray? You need to know the J code or the CPT code of it. Nobody knows that. I mean, you can look it up on Google, yeah, and then find it. That's the cash price. That's not the negotiated price. And then Medicare has its own negotiated price. So that's a very roundabout way to say it is so complicated. There's not one good or bad player. They're all trying to get their portion of the healthcare dollar. And it's created a lot of complications.
All comes down to money? Is that what you're saying?
Follow the dollar.
Yep. Okay.
Follow the money. Follow the money. Yes.
Okay.
Yes.
All right, so how are we doing on time here?
We have covered the 2026 changes, I believe. This is the tool that I referenced, the Plan Finder tool. I think it's fantastic. If you are comfortable on a computer, you can do a lot of your own research. And some people just call us to just check their thinking, and then they go off and do their own thing, which is totally fine. Other people are not very computer literate, and so they want to sit down with us and go through that, and we will do that too. This is the tool I use and trust. It's way better than healthcare.gov, in my opinion. I've used that one too. This one has a lot more functionality to it.
Okay, and what is that site again?
It's Medicare.gov.
Medicare.gov, okay.
Yes. If you sign in, if you have a Medicare.gov account, like a Social Security account, your specific information will come up. It will tell you what you currently have today and allow you to compare it to, but you don't have to log in. You can do it anonymous. look at what's out there.
Okay.
But you can sign in and have it personalized. Yes.
I have a friend who also is SilverScript, both, and she has already tried to go online and look at the plans. She said the minute she signed off her computer, her phone started ringing with different companies. So is anonymous a better way to prevent being deluged?
I would question whether she was really on Medicare.gov, because there's a lot of other sites out there that look like Medicare.gov, that aren't Medicare.gov, and Medicare doesn't ask for your phone number. It doesn't ask you for anything. So if she got phone, she probably put her phone number in, and yes, that's what happens. Do not do that. Do not do that. And if you Google search, the first couple of things that come up will say sponsored, sponsored, sponsored. Don't do those. Don't do those. Find the one that is Medicare.gov, and in the top right left-hand corner, it'll say, this is an official site. How do you know it's an official site? So that's the only one to use. All those others, yeah, they're hunting for your phone number or your email, and they are relentless. Relentless. They will take your last drop of blood. Yes.
Actually, this year, because the last 2 years, I had to wait until towards the end of November to get even. I would put in, prescriptions that are normally $2. And the prescription drug costs were not programmed in correctly because it did not accurately portray. And healthcare came up as much more expensive than another program where you had to pay $25 a month with the drugs that I have. Is it accurate this year?
That's a great question. The question is it accurate this year? So, today's Wednesday.
What year before?
Monday.
All other years have been great, but last year and the year before, the drug costs were just astronomical.
They did go up a lot, and that is because of the maximum out of pocket they put in. So they were trying to fix a problem for all the people that fell into the donut hole and in catastrophic, and protect them from high cost. But what happened, and that was a good thing, but what happened is that all of the rest of you that were not paying anything are now paying a whole lot more.
I had to call the companies to find out what they actually charged.
They are allowed to update their pricing every 2 weeks. So if you are, now it can't be a substantial change. So Medicare will look at it, and like if it goes from $10 to $20, they're gonna say, hey, was that a typo or is that right? And so they do watch for significant changes. What I would do is I would save copies of what you're finding in Plan Finder. They do have a special enrollment period this year. If you make a decision on a plan based off information in Plan Finder, and this is related to the new doctor thing. So I went in, I put Dr. Smith in, said Dr. Smith was in this plan, and so I joined this plan, and it turns out in January, Dr. Smith isn't in the plan. You will get a special enrollment period to change to something that Dr. Smith is in because of what was in Plan Finder. And you have to keep a copy of it and enroll through Plan Finder, not through a broker, but through Plan Finder. Then you'll get a special enrollment period.
So you have to enroll through Plan Finder.
Yes, enroll through Medicare.gov. So when you go up, I wish I had a live computer here, but when you go in and you look at plans, there's a blue button that says details, and you can pull up all the details about the plan, and there's a green button that says enroll. You can self-enroll yourself in that plan. So that's how I help you enroll. You can either do it yourself, you can tell me to do it. I hit the green enroll button, you give me your information, I enroll you, I email you the confirmation, and we're done. So if we do it through Medicare.gov, you get the protections of what they publish in their system. is good to know. So back to the pricing, is it accurate? I would like to think that it is, because we're all making decisions based off that information. I have found that the closer you get to December 7th, the more accurate the information is. The information between October 1st and October 15th was not accurate at all. Once it went live, I felt there was less variation, and then it even got closer and closer on December 7th. So I do think it's important to keep copies of it.
So maybe you need to start your research, but not make your final determination till closer to the deadline? Is that?
Well, I think you can actually do multiple enrollments. It will take the last one that comes in. So let's say you go on there today, you decide, I want to get this thing done, you enroll yourself, you pick Plan A. You go in there on December 1st just to do another check. Plan A is good, you stick with it. But you find Plan B, and you'd rather be in that one, you can enroll in that one right there. It will automatically cancel out A, and you'll be in B. It's going to take the last one, and you can do it as many times as you want up through midnight of December 7th.
Versus, what if you, so that's doing it yourself on the website. So what if you go talk to a broker and do something with them? Is that changeable?
It is changeable, yes. Everything is changeable. You can do it with the broker. If they're not using the Plan Finder tool, you may not get the protection of the special enrollment period for doctors in the network, and that's on the Medicare Advantage side. But you can still do it. You could do it with a broker, and then you could change your mind and do it yourself on December 7th. Now, the risk, would I wait till December 7th? No, I wouldn't. Do you guys know what happened Monday?
Yeah.
Yes.
The Amazon Web Services blew up, right? Now, I don't know 100% for sure that Medicare uses Amazon Web Services, but the Plan Finder was down most of Monday. So I'm like, oh, okay, here's this big network outage on the East Coast, and the tool that I'm using isn't working. Might there be a relationship there? There might be. I haven't seen anything formal about it, but that's why I wouldn't wait till December 7th. Get it done by December 1st, just in case there's another outage.
That's kind of funny. I heard you say, keep a hard copy, print it out. So I'm a paper person, and I work with a lot of younger people, and they're like, you're so old school with your paper. But more recently, there's been things come up about, well, your paper is always there, So when we had this outage on Monday, what do we as realtors use? We use, electronic document signing and preparation, and nobody had any forms that were already printed out. And I said, that's why you need to have some paper on hand.
That's right.
Have those already printed out, otherwise you could have just wrote it right in there. Old school, it still works.
I save soft copies too of everything. I save soft copies of everything I do for my clients, and I have it on my Google Drive. So assuming Google doesn't ever go poof, I do have that. But I also print and mail. I'll either email it or print a copy and put it in snail mail to you.
Okay, good to know. I think one of the things that I'm not sure where we're at here, but the negotiation on drugs.
Yeah.
Have we been there yet?
We have not.
Okay, I just want to make sure
Here
we
we
get
are.
that.
Yeah. So 10 drugs were selected for price negotiation by the federal government. There's more than 10 on this slide because some drugs are under more than one category. For example, Enbrel and Farxiga. And there was a negotiated price which says the plan cannot charge any more than whatever the negotiated price was. Some of you probably affectionately know a few of these drugs. because they
Aliquis is a big.
throwing you in the donor hole.
That,
Yeah.
that doesn't cover if the company pays for that drug. My Enbrel is paid by the manufacturer.
I don't know how I have heard that before. I don't know how you get on, there are prescription
You have to
assistance
apply
programs.
for it.
You have to apply for
You
them.
have to send them 2 years of your taxes and the whole 9 yards. You have to prove.
A lot of those are going away, and many of them don't allow people on Medicare to participate. So if you're able to get on one, great. But many Medicare beneficiaries were not able to get on them. And so the price negotiation helped at least stabilize some of the prices. Now, these drugs still landed in tier 3, and plans have to cover these drugs. They can't remove them from the formulary. So that was the worry, was that, oh my gosh, Medicare's negotiated a price and the plans are just going to dump it off the formulary. That is not true.
Are these typically injectables?
Not necessarily. Not necessarily. There are some that are under B, A, and D. They picked them based off not having a competitor product, so they were brand with no generic on the market, and they fell within the top spend based on medications. There's 10 more each year, so they've done 3 phases of this. This is phase 1 of the medications. There'll be 10 more next year, and I think there's 15 the year after that, and they keep picking, they're picking brand name drugs with no competitor to it. Now, Eliquis actually has a generic to it, but you can only get, Plan Finder only shows one strength of the generic, and I will say this is a weirdness of Medicare. The brand is often cheaper for you. And the reason for that is because of rebates that are happening on the back end. Rebates help lower, stabilize premiums for everybody. But the user doesn't actually necessarily get the benefit of the rebate. So in most cases, rebates went away for a lot of these drugs. Plans tried to put them on the non-preferred brand tier. Medicare said, it's going to go on the preferred brand tier. And that's why so many preferred brand tiers now are a co-insurance, which means it's a percentage of the cost.
Do you have any idea like what any of these negotiated prices are? Like,
I don't without.
okay,
Yeah.
without going, okay, so you've got a website on there.
That's a fact sheet from the government that talks about, I know I read it, I can't remember if the actual prices were on there.
Okay.
I want to say Eliquis is still like $1,100 or $1,200 a year,
Okay.
which is pretty significant decrease because it was several hundred a month, and now it's going to be $100, $200 a month.
Okay.
Yes.
As you put that up, I immediately went to Perplexity and pulled up and got the prices for both Farxiga and Jardiance. AI is your friend. You can find so much stuff, like within 5 seconds of that coming up there, I knew how much I was going to save next year on Jardiance, and I'll save another $22 a month if I switch over to Farxiga. So thank you for doing that, but I use AI all the time and everything, but I'm smart enough usually to figure out when it's wrong, and it can be, but
Yeah.
boy, does that fast. It's much better than Google was 5 years ago for finding stuff.
Yes, I do still recommend double checking. I've had it give me some really bizarre Medicare answers, and I know enough to know that it's wrong, but I worry about people who don't, so double check it.
And so you found that that information is correct, that because of these negotiated prices that you ultimately can save.
I'll save $200
Right.
a month, yeah.
$200 a month?
Well, they're hitting me a lot on Jardiance, and now it's $179. It's cheaper, and I was waiting for the generic to get cleared, but what was it? I had it down. $197 for Jardiance and $179 for Farxiga. I mean, those are big savings.
Big
Okay.
savings, yeah.
Good.
Now, does everybody else's rate is this like capping insulin costs, is every other cost of health insurance going to go up to cover this? Or is this just
Well,
being
it
eaten by
has.
the drug companies?
It has, right? So that's why you're seeing co-insurance on the brand tiers. And in fact, even some non-preferred generics are going co-insurance. It's why you're seeing the deductible being applied to all meds and not just tiers 3 through 5. So yes,
No free lunch?
yeah,
Yeah, much, right? They're just moving it around, right? Okay.
yeah.
All right, so we've got about 5 minutes left, and I know we've been taking kind of questions midstream here. So is there anything else that is like really important that we should have you talk about?
I'll just close with the reminders of review your annual notice of change. And then before you enroll, here's usually what I look at. I look at whether doctors and hospitals are in network. This is on the Medicare Advantage side. For both either decision, Part D or Medicare Advantage, review your prescription drug coverage and understand your cost sharing. The tool will actually give you a pretty good explanation of yearly costs and monthly costs by pharmacy. And put in several pharmacies, you'll find that there are some pretty significant differences between the various pharmacies available. Yes?
With pharmacies, I was on Medicare.gov, I would do all the pharmacies to see if had the better price. And then I checked with, and usually it was Walmart. But last year, even though Costco said that it cost more, Costco, I come out with no copayment at all. And many of the drugs that are on WellCare, the cost that they charge under the prescription plan is much more than what Costco charges, just buying it through Costco.
Cash?
So we might, everybody might want to change with Costco.
Yes, so here's, the comment was about the actual experience at the pharmacy and what you pay out of pocket might be different from what you're seeing on Medicare.gov. That's very possible. There's also this game, and I can't, as a pharmacist, it breaks my heart to even say this, but you can actually see some drugs are cheaper at Walgreens, some are cheaper at CVS, some are cheaper at Dearborn, some are cheaper at Walmart. So move around. Now, as a pharmacist, that breaks my heart because the pharmacist can't see all your prescriptions if you're patronizing multiple pharmacies. But in reality, if you can save a lot of money, that might be important too. So I'm very conflicted, and I can't believe I even said that, but yeah, that is the
That's
reality of it.
just the state of this, the situation.
The other thing is some drugs are cheaper on like GoodRx, Single Care, Amazon, maybe cash at Costco, or Cost Plus. So it does help to shop around, and the ship counselor can help you shop around as well. If you buy outside of your benefit, it doesn't count toward your maximum out of pocket. So you need to think about that too.
Factor that in.
Yeah. Yep.
But if mail order usually the best way to go.
Question is, no, the question is a mail order always cheaper? No, it is not. And so you can pick that as one of your pharmacies, and I do recommend that because in some cases it is. I had a couple yesterday where if they went to mail order, everything was $0. And if they went to retail, it cost more. But that's not always the case. In some cases, I found that retail is cheaper than mail order. I don't know how to explain that.
So what about the, you said GoodRx and Single Care, was there anything you wanted to comment on that?
Those are
There's discount cards?
Yeah, those are sort of discount coupon card programs. The pharmacies are very aware of them. I don't know that they love them. But at the end of the day, if it's cheaper for you to get your medication that way, then do that. Do that, yeah.
You can always ask them to run it with the discount.
Yes, you could ask them, right.
Yeah, and ask them what the cash price is.
Yeah, and a good pharmacist will give you the lowest price. They'll tell you, hey, you need to be doing this for this medication. They'll help you out that way.
And you were talking about, you were looking at different things for individuals that you were helping. Again, is that on the Medicare.gov site, or where is that? And is that available to people, or they need to go meet with the SHIP counselor?
For which things specifically?
You were talking about the different drugs. Like it came up zeros, you said, by doing mail order or something.
Yeah. You can see that on Medicare.gov.
Okay.
Yeah, it will show you, it'll list all your drugs, it will show you the annual cost by pharmacy, 1, 2, 3, 4, however you pick, up to 5 pharmacies, I think. And then you could go down into the pharmacy and you can say, oh, well, what does each drug cost by pharmacy by month? Yeah, there's a lot of information there.
Mhm.
People will sometimes get focused on premiums and deductibles, but really what you should focus on is the total annual cost. And Medicare does a good job of sorting those plans by overall cost, premium, deductible, and copays. And on the Medicare Advantage side, it will also by star ratings, move things up. So that's really what you focus on, is the total cost. Some people get really focused on deductible and premium, and sometimes that's not the way to pick. Thank you for being so lively and
We have a very educated group of people here.
We do.
And they like to know things, and that's why they come. So, can I borrow that just for a second? Was there any last comments you wanted to make, Rebecca?
No.
No? Okay, am I going backwards or am I going
Yeah,
forwards?
no.
Oh, annual notice of change. If you can't find that because it was so, I didn't even want to read it, it was so not pleasant looking, where can you find that at? Can you go on the site and find it?
You can go on the plan website and find a copy of it there. The summary of benefits, as well as the annual notice of change, and the evidence of coverage. Yes.
I have United Healthcare, and the plan I'm on, and I've been on the same one for years, but this year, it's just a nightmare. They got rid of the over-the-counter, they got rid of all the dental, quite a few other things. Yet another United Healthcare plan, which is, I have an S, I won't say what number, and then another S, another number. That one has $4,000 dental, $90 a quarter over-the-counter, and it's got way more than the other one, and yet it's still United Healthcare. How can they, and it doesn't cost me any more. It has a little bit higher out of pocket, but all the out of pockets going up. This year I
Right.
get 2,800, next year it's 34, theirs is 39, but $4,000 dental and then $90 a quarter offset that extra out of pocket of $700. How can they be so different? It's not costing me anything different,
Yeah, I don't know why there are so many plans. Humana, for example, has 15 plans in our area. I'm like, are those even meaningfully different from each other? I don't know. But the question here was, she was on a United Healthcare plan that had a bunch of supplemental benefits that got pulled back this year, but United offers other plans that have richer benefits. So that's exactly the reason why you go in and you do a plan review so that you can move from one plan to the other. I also had a very bizarre situation yesterday where I put those 5 doctors in, and none of them were in this United plan. All of them were in this United plan, and I'm like, what? I don't understand that. So maybe there's some strategy that United's trying to move people out of this plan into these other plans.
but they're costing them more money to put you into the one that has.
Yeah, we think so, but
I don't know their strategy.
That's right.
I don't know why there's so many choices. And it might be because these supplemental benefits have different value to different people. So you might be picking on dental, you might be picking on hearing aids, you might be picking on the OTC card, and they want to be able to pick and choose. Essence, for example, sort of simplified things and said, here's a flex card with a bunch of money on it, use it however you want. And I think some people like that.
Like Taco Bell or?
No, you can, no. No, not Taco Bell.
Oh, well, you said use it as you want.
Well, for hearing, for vision, for dental, for over-the-counter stuff. Yeah, anything related to your home benefit. Yeah.
All right. Well, real quick, I want to mention our next month's seminar, and it will be Steve Jones with Jones Elder Law will be here. We're going to be talking about the asset preservation, so spend down, and your adult children, are they marvelous? Are they manipulative? So that was a recommendation from one of our attendees. So how to safeguard your assets and guidelines on how to protect yourself from your children's debts. Can your adult children put you in a home, and more. So I hope you all will come back for that one. And
I've heard him speak, he's excellent.
Yeah.
He's an excellent seminar.
yeah, we've had him in before, so we've enjoyed having Steve. So you have been wonderful. Thank you so much. This is a very confusing thing. So I think I can safely say you can really benefit from talking with the SHIP counselor. It's free information, so.
I noticed some people snapping pictures of you can distribute this if they want copies of the slides.
Okay, great.
They have it.
Thank you. Yeah,
Okay.
yeah, we can post that on the website too.
Great.
All
Thank you all.
right. Thanks,
Appreciate
Rebecca.
it.
You've been wonderful. Appreciate it.